Chapter 5. Medications Unveiled. Namaste, Mrs. Desai. I understand that being diagnosed with diabetes can feel overwhelming, but I'm here to guide you every step of the way, including helping you understand your medication options, Dr. Yash Patel said warmly. Namaste, doctor. Yes, it's all a bit much to take in. I keep hearing about so many diabetes medicines and treatments, but I don't really know how they work or what's best for me. Mrs. Meena Desai replied nervously. That's perfectly normal, Mrs. Desai, and you're not alone in feeling this way. Let's start simple. I'll explain the main types of medications used for type 2 diabetes, especially those most common here in India, Dr. Yash Patel said kindly. Mrs. Meena Desai said that would be very helpful, doctor. Metformin. Dr. Yash Patel explained that first. There's metformin, one of the oldest and most trusted medicines for diabetes. It works by reducing glucose production in the liver, lowering its absorption in the intestines, and improving your body's sensitivity to insulin. For most patients with type 2 diabetes, he starts with metformin, unless there are reasons not to. He added that it's effective and has a very low risk of causing hypoglycemia or low sugar levels. Mrs. Meena Desai asked, curious, if there were any side effects she should worry about. Dr. Patel reassured her that most people tolerate it very well. Sometimes, at the beginning, it may cause stomach upset, nausea, or diarrhea. But he told her not to worry. These usually improve over time, and a mindful diet can help reduce them. When metformin isn't enough. What if metformin isn't enough for me? Mrs. Meena Desai asked. In that case, we have other options. One group is called sulfonylureas. These increase insulin production from the pancreas. They work well, but they carry a higher risk of hypoglycemia, especially in elderly patients, Dr. Patel explained. Modern medications. Mrs. Meena Desai asked if the doctor could explain about those new medicines she keeps seeing on TV ads. Dr. Patel, knowingly, replied that she must be talking about GLP-1 receptor agonists and SGLT2 inhibitors. He explained that GLP-1 receptor agonists help the body release more insulin when needed, suppress glucagon, and even support weight loss. SGLT2 inhibitors work differently. They make the kidneys pass extra glucose through urine. They also help with weight management and provide heart benefits, which is very important if someone has both diabetes and heart issues. Mrs. Meena Desai responded with relief that this sounds promising, especially since she does have some heart problems. Dr. Patel agreed and said that these medicines might be a good fit for her, but they will carefully look at her overall health before deciding. He emphasized that diabetes treatment isn't only about sugar levels, it's about full health and quality of life. The conversation turned to cost concerns. Doctor, are these newer medications very expensive? Mrs. Meena Desai asked hesitantly. That's a valid question, Dr. Patel replied. Metformin is very affordable, but yes, newer medicines like SGLT2 inhibitors and GLP-1 receptor agonists can be costly. The good news is, India has government schemes, insurance options, and generic alternatives that make them more accessible. Don't worry, we'll find a treatment that works for your health and your budget. Thank you, doctor. It's reassuring to know I have options, and that you'll help me choose the right one, Mrs. Meena Desai said, smiling and more relaxed. Of course, Mrs. Desai. Managing diabetes is a team effort. We'll review your progress regularly, adjust medications if needed, and I'll always be here to answer your questions. Dr. Patel replied gently. I really appreciate your support, doctor. It feels good to know I'm not alone in this journey, Mrs. Meena Desai expressed with gratitude. Dr. Patel smiled warmly and said, You're certainly not alone, Mrs. Desai. We're in this together. My goal is to help you live a full, healthy, and happy life, even with diabetes. This chapter captures a meaningful and educational dialogue between a diabetologist and a patient in India. It highlights the importance of personalized care, affordable solutions, and the supportive role of healthcare providers in managing diabetes effectively.